Welcome to Sciencera. In this video, we're going to discuss some of the past exam papers for clinical pathology. Let's begin. Question number 1 states, distinguish between labile, stable and permanent cells and place each of the following cells, tissue types into the appropriate category. So they have given you 5 different cells. These are hematopoietic, glandular, glial, osseous and scar tissue. Starting with distinguishing between these 3 types of cells. So, labile cells. Labiles are continuously dividing tissues. Cells of these tissues are continuously being lost and replaced by maturation from tissue stem cells and by proliferation of the mature cells. Hematopoietic cells in the bone marrow are the examples of labile cells. Most surface epithelia, such as the stratified squamous epithelia of the skin, oral cavity, vagina, and cervix. The cuboidal epithelia of duct draining exocrine organs, columnar epithelium of GIT, uterus, fallopian tubes, and the transitional epithelium of the urinary tract. These tissues can readily regenerate after injury if the pool of the stem cell is preserved. Then we have stable cells. Stable tissue cells of these tissues are quiescent and have only minimal proliferative activity in their normal state. These cells can divide in response to injury or loss of the tissue mass. Stable cells constitute the parenchyma of most solid tissues such as liver, kidney, or pancreas. They also include the endothelial cell, fibroblast, smooth muscle cells, and the proliferation of these cells is particularly important in the wound healing, except for the liver. Stable tissue have a limited capacity to regenerate after the injury. Then we have permanent cells. Permanent tissues. Cells of these tissues are terminally differentiated and non-proliferative in the postnatal life. Most neurons, cardiac muscle cells belong to this category. Thus, injury to the brain or heart is irreversible and the result in the scar because the neuron or cardiac myocytes cannot regenerate. Limited stem cell replication and differentiation occurs in some areas of the adult brain, and there is some evidence that heart muscle cells may proliferate after the myocardial necrosis. Nevertheless, wherever the proliferative capacity may exist in these tissues, it is insufficient to produce tissue regenerative after the injury. Skeletal muscles is usually classified as a permanent tissue, but satellite cells attached to the endomesia sheath provide some regenerative capacity for the muscles, and the permanent tissue's repair is typically dominated by the scar formation. This was the part 1 of the question. And second part state that we must categorize these cells in the different categories. So, categorizing different cells, hematopoietic are the labile cells, glandular are the stable cells, glial are the permanent cells, osseous stable cells again, and scar tissues are the permanent cells. Next question is, discuss the formation of free radicals and their impact on the cells and tissue health. Free radicals are highly reactive anion with an unpaired outer or orbital electrons. They react with inorganic or organic chemical to form further free radicals. Some examples are reactive oxygen species like hydrogen peroxide, superoxide anion radical, and hydroxyl radicals. Nitric oxide made by endothelium, macrophages, neuron, and the other cells. Then they ask you for the formation. During normal cellular energy generation by oxygen reduction and electron transfer, killing of pathogens by phagocytosis, ROS are performed in a membrane complex. ROS are your reactive oxygen species. Unwanted by byproduct of intracellular oxidase reaction, radiation generates hydroxyl and hydrogen free radical by ionizing water. Toxic byproducts of drug chemical metabolism by cellular enzymes, for example in the liver. These are the all type of formation of the free radicals. Then they have the impact on the cells or tissues health. Harmful effect of the free radicals include number 1, lipid membrane damage by peroxidation affects the cell membrane and the membranes of the organelles. Protein damage by amino acid oxidation, cross-linkage or protein breakdown. for example, microtubule aggregation. DNA damage can cause mutations and cancer. They are also induced by several external agents. A classic example is carbon tetrachloride, CCl4. It is believed that CCl4 causes hepatic toxicity by the free radical attack. This was your number 2. Then we have question number 3. Write an essay comparing cell death by necrosis or apoptosis. Ensure that you describe the sequence of events within the cell associated with each type of cell death and causes of each. Before we move on, I just want to remind you, you can buy these notes on Sciencera Tutors on the Stuvia website. Let's begin. Apoptosis, often called programmed cell death, occurs during the embryological development as new tissues are formed and remodeled, or in physiological cycles such as the menstrual cycle. Apoptosis is characterized by orderly breakdown of cellular constituent, which are packaged into membrane-bound vesicles and tagged for collection by phagocytes. This requires energy. The initiation of apoptosis is as follows. Number 1, binding of a death ligand on the cell surface, for example, direct binding by the T cells or NK cells, or tumor necrosis factor secretion by the immune cells. Then membrane disruption by perforin, then intracellular injection of granzymes B by a cytotoxic T cells, release of pro-apoptic protein cytochrome C for leaky mitochondrial membrane, a process largely regulated by the pro and anti-apoptotic proteins of the BCL2 family. TP53, or a gatekeeper gene in the cell cycle, P53 protein instigates apoptosis if there is a failure to repair DNA damage. Once started, apoptosis is generally irreversible, involving a final common pathway of an intracellular cascade of capaces. Proteolytic cleavage of cell contents and water loss causes cell shrinkage. Fragments bud off, enveloped by the cell membrane, which expresses a new ligand. Apoptosis does not stimulate an acute inflammatory response. Instead, macrophages and adjacent cells bind the new ligand and phagocytose the fragment. This was your apoptosis. Next part is the necrosis. Necrosis is the type of necrosis is dependent on the nature, intensity, and duration of the injurious agent and the type of the cell involved. Note that the initial membrane damage allows calcium 2 plus leakage with subsequent activation of calcium dependent phosphatase and lipase. Coagulation necrosis, cytoplasm of the necrosed cell become eosinophilic and persist for many days. For example, in myocardial infarction. Colliquative necrosis, cell undergo lysis rapidly. Then we have caseous necrosis, myobacterium tuberculosis interact with macrophages. Gangrenous necrosis, primary bacterial toxins or secondary ischemia infection. Fibrinoid necrosis involves smooth muscle necrosis, fibrin release, malignant hypertension. Then we have fat necrosis, involve inflammatory response to liberated fat fibrosis. There are also nuclear changes related to necrosis. These are meridianation of chromatin, chromatin condensing around the periphery of the nucleus, pycnosis, small and dense nuclei, karyolysis, complete lysis of nuclei, and karyolysis, fragment nuclei generally seen in the apoptosis. Irreversible cell injury is typically accompanied by the release of intracellular enzyme, cardiac muscles, keratin kinase, aspartate transaminase, lactate dehydrogenase, hepatocytes, alanine transminase, striated muscles involve keratin kinase, isoform, exocrine pancreas amylase. Loss of membrane selectivity may be helpful in diagnosis through the uptake of dyes, inflammatory response initiated by the products or mediators of the necrotic cells. Next question is, a 65-year-old presented to his local doctor complaining of worsening dyspnea, cough, hemoptysis over the past 6 weeks. He smoked a packet of cigarette per day for over 40 years. Described why carbon monoxide, nicotine, and chemical carcinogens are harmful to the body. In your answer, explain why smoking increases a person's risk of cancer, heart attack, and respiratory illnesses. Let's continue. Oxygen is essential to our lives. It is needed by our body system for them to function properly. Also, it is needed to keep our bodies healthy and help us breathe. But when we breathe carbon monoxide into our bodies, it becomes dangerous. Instead of breathing oxygen, our bodies become deprived of this because of the carbon monoxide being inhaled. Thus, our body becomes deprived of oxygen, which could lead us to the experience of shortness of breath, muscle weakness, chest tightness, and confusion. This could also mean more risk for smokers since cigarette smoke contain a lot of carbon monoxide. Images that Imagine that every time someone smokes, he adds this chemical to poison his body and cause more harm to his health. We all want to breathe in more oxygen than any other gas into our bodies. Let's think of this as one of the way to keep our bodies and mind healthy. There are many chemical components found in cigarette smoke, and one of these is nicotine. This chemical is very dangerous and highly addictive, and this keeps smokers develop the habit to smoke cigarettes. It can affect our heart and especially our lungs. This could lead to increased blood pressure, increased heart rate, and diarrhea. Also, we also have second-hand smoking where the smoke from the cigarette is being inhaled by another person. These second-hand smokers take in the nicotine the same way smokers do. Second-hand smoking is also dangerous. It could lead to more complicated problems and medical conditions, including lung cancer. There are other chemical carcinogens that are also harmful to our bodies, and they could also lead to the cancer. Some of these include asbestos, benzene, and arsenic. All of us are at the risk of this. With smoking, you just don't cause harm to your body, but affect others as well, even our loved ones. One of these chemicals, smoking can really lead to serious illness, affect the heart, lungs, and other parts of body. We may have seen smoking labels with warning of what could happen to us when we continue smoking. It is really alarming to see the signs and pictures, but the chemical contained in them seem to be highly addictive, including the nicotine. For many, it is hard to quit and stop smoking. It appears the smoking has become a part of their lives already. This can cause lung damage. We could develop diseases such as COPD, including emphysema and chronic bronchitis, pneumonia, and tuberculosis. Smoking can damage our lungs and cause impaired lung capacity and function. When these chemicals are stuffed into the lungs more than oxygen, lungs become more congested, making it even hard for smokers to breathe properly. This is also a health risk for our heart, and it affects blood flow and may cause plaque built up as seen for the someone with peripheral arterial disease, increasing more complications. This causes the blood to thicken and form clots in our veins and arteries. Our blood will try to compensate until it becomes harder to do so. One of the symptoms include high blood pressure, with one being at the risk for heart attack, stroke, and coronary artery disease. With these being seen, we are all exposed to different chemicals every day, and these could lead to us to different illnesses. As with smoking, this is the only one of the diseases that could bring harm to our bodies and possibly even cause death when not treated early and properly. Again, let's promote good health and for everyone, even to ourselves. This was all for today's video. If you want the notes, you can visit my page on Stuvia. It's called Sciencera Tutors, and there's a link in the description for the textbook and the notes. Thank you so much. If you like my video, don't forget to subscribe for more.